My name is Adam Hunzeker. I am a psychiatrist here from Pinehurst, North Carolina. And mental health and family medicine is a fascinating topic to talk about, especially when you look back on traditionally, the family medicine doctor was just a doctor and it was somebody who did everything. They were primarily responsible for everything. Um, and so, especially, traditionally, 80%, I think, the last time I saw some sort of statistic associated with it, is the amount of psychotropics prescribed by a primary care physician. And what's really evolved is the specialty itself. There's been so many more medications, so many new approaches. There's genetic testing now. There's different kinds of interventions that have really created a large burden on primary care to try to open up this brand new body of knowledge of which they have to try to absorb. In addition to everything else with the human body, I would say the body of knowledge has expanded significantly. And especially, one of my personal passions, one of them is dementia. Dementia is booming. Both my parents are, dealing and struggling with certain issues associated with it, and it's one of those things where it's growing in the country. Our population is getting older, and it is huge. And so, for primary care to absorb that, that's a huge burden. So, I would say that they are being asked to do more, and many times with less, which is kind of the prerogative of family medicine. And so that's why it's so important to have family medicine and mental health collaborate and work together to try to figure out a solution. Some of the major barriers that family medicine doctors really run into: time, and time. And so right now, the people are being asked in 15 minutes to try to figure out stuff that I may be given an hour for. So, or that I am inpatient. The reason why I really like inpatient, I may be given days to figure out. And so they're given 15 minutes and they're trying to figure out, is it dementia, psychosis, or drugs? And good luck. That's a very tall order to ask. So and time. One of the hard things about mental health is lots of people have different pictures of what mental health is. And that's not abnormal for medicine because a lot of people don't understand the medicine structure. They don't understand primary care, then gives out referrals, takes back information, makes collaborative decisions based on, like, they don't understand. They're like, my nephrologist told me this, and my neurologist told me this, and my, spinal doctor, and they're just like, I have no idea what's going on. Mental health is no different. But the answer is, and I'll say, let me start with a statement of humility. I don't know everything, right? And so I don't understand cardiothoracic surgery or the right way to do that. But a lot of people don't understand how to get into behavioral health. Like, what's the difference between a counselor? What's the difference between a psychologist? What's the difference between a psychiatrist and a psychologist? Do I want to start out with therapy first? Does psychiatrists do therapy anymore? Like, there's all these confusing parts to it. And the first thing, though, I would say is I've seen lots of chaotic environments in my life, both in my civilian life and my military life. When things gets crazy, people lose their minds, right? If you sit there and you help people understand, like, hey, this is what this is, this is what this is, this is what this is. You got 4 minutes to wrap that up. You go, hey, this is a super smart way for you to approach mental health. It sounds like you may benefit from it. And on that card, there'll be information like, hey, here's Dr. Hunzeker in the ER. This is who you call if things are really bad. Hey, this is Dr. So-and-so. This is who you call if you want to change your medications. Hey, this is who you call to, talk to somebody because you want to do talk therapy. And these are your routes to do it, and then you give it to them because they're going to appreciate resources. And it is crazy in 2024 how many resources there are. So it's like, this is going back to that technological piece, which is we have so much technology. We don't do a great job of using it. And if you have 4 minutes, you got to come up with a better way to do that workflow. And that's that. Technology will solve one problem, but workflow is a very important part of that. Like, how does my workflow go when I run into this scenario where someone needs a lot and I have 4 minutes? And it may be, hey, here's a great referral network where you can have an open thing to deal with that. And behavioral health, man, that has to be 15% of primary care. So either directly or indirectly. So it's worth the time spending into workflow. Stigma, I believe, my personal belief is that stigma a lot is of the provider in the first place. If you approach people and you just toss off the whole thing, if you're acting like it's a shameful question to ask somebody, they're going to ask if it's a shameful question. I promise you, lots of time, if you just ask somebody about it, they're going to tell you. But the other thing is you can't do it in 3 minutes. You can't open that up and talk about depression and talk about those things and expect to get to the bottom of it in 3 to 5 minutes. Like it's going to be a thing that's going to open up. If you think someone, it's not that hard to come in and see someone's not doing well. You know, they look sad, they look depressed, and they look like they've been crying all night long. And you ask them how they're doing, and then you shut them down after 2.5 minutes with your quick, I'm in and out, and they're not going to respond to that well. Some better ways that family medicine providers can integrate technology, especially for mental health care, is get a series of things for mental health care. Now, where I like to do that is in sort of a series or collection of applications. Earlier on in my career, I've always really had a desire for inpatient, like severe mental illness has been my passion. But I've had to do outpatient before, or I've done mental health care across all the continents and across all sorts of deployment situations. There's always some sort of application, phone access, something where people can have some self-care where they talk about deep breathing, mindfulness, progressive relaxation, these simple techniques of, and you can even call it whatever you want. It can be meditation, right? It doesn't have to all be therapy. These are all synonyms. These things all mean similar things, but they can help. And so a lot of that integration, again, is getting a repertoire of known and trusted things that the provider understands. It doesn't have to be a ton, right? It should be like, hey, these are some interventions for progressive relaxation for people who suffer from a lot of stress. They're too stressed. Hey, this is something for people who have perseverative anxiety. This would be good interventions for them. And then have it. And then you can, again, get those little cards where it's like, hey, they say all the answers that you're looking for right here. This is what you need. And then, let's have a follow-up if you've got further questions on that. But if you build that workflow information for it, I think that makes it a lot easier. Some of the ways that family medicine doctors can collaborate, the first part is trying to collaborate. That's one of my biggest things that I'm out here doing with people. I take my time out to meet with the people in our local area. Sometimes we'll do something silly, like we are in the golf capital, right? So we'll go golfing together. We'll talk together. We'll ask questions. You network and you give your information. But it's really setting up models, because I'm not sure if you're aware of this, but I'm a psychiatrist. You really don't want me managing your diabetes or your hypertension. I'm not very good at it. I'm very good at taking care of your mental health, but your blood pressure and those things. So it's a two-way street. Our patients are the same, and especially that's why I choose to practice in a system. I like being in a system where I have access to all different kinds of doctors and we can collaborate and talk. But the first step is to reach out and talk to somebody. Learn the people who are in your area, reach out and talk to people. And that's tough in some environments, especially, you would say that, because I'm considered in a rural environment where I'm currently at. One of the hardest problems I had for taking care of my own family was living in a city like Los Angeles, is because there were so many providers, but there was no collaboration within systems. So your nephrologists were out over here and your family medicine doctors were out over here, and you were in different systems, different pay structures. It was so hard to communicate and truly collaborate. But in here, it's a smaller group of people. So I may be the only psychiatrist within 4 counties. So there's more of an impetus to lean in and take care of each other. But yes, the first step in collaboration, reach out and try to collaborate, which is very hard. Again, going back to the time, you got 15 minutes, you got to see 25 patients. And, but the true answer is it'll pay in dividends down the road, because with a few conversations, you may save time in the long run if you learn a better way to deal with it, or a better management and referral system. That's super important. So you're like, I know I can't take care of this, but this is the bucket that I'm going to put it in, and I have a good relationship with them.